Hi everyone, welcome to Anugrah Case Series where we discuss radiology through a case-based discussion. I'm Dr. APARNA PRAKASH. I've done my MD from PGI Chandigarh. I'm a fetal medicine, pediatric and women's imaging specialist, and I'm the director and chief radiologist at Anugrah Health and Diagnostics in Jaipur, and I'm also the senior consultant radiology at Surya Hospitals, Jaipur. So today I have the case of a 42-year-old lady who came with complaints of severe pain in the lower abdomen since 5 years, and multiple ultrasound scans had revealed a large fibroid. So we went ahead and did a DVS for this patient, and definitely there was a large fibroid present along the anterior fundal aspect of the uterus. It was a pedunculated fibroid which showed a connection with the uterus over here, and it was definitely a very large fibroid, and which must be causing this patient a lot of pressure symptoms. On measuring the fibroid, it measured approximately 200 cc in volume, and this is the 3D of the patient. This is the 3D of the same fibroid, and here is the uterus, and here you can see this large pedunculated fibroid along the anterior fundal aspect appearing much bigger than the uterus itself. Following the protocol, I went ahead and looked at the ovaries, and I saw this small cyst. It was only 13 mm in size, but it did show this layering of echoes. So here is the hyperechoic layer, a slightly less hyperechoic layer, and then an anechoic layer in this cyst. And then it made me think that maybe we are dealing with a case of endometriosis. Now, because I was suspecting endometriosis in this case because of the layered cyst seen in the right ovary, I went ahead and did a scan through the posterior vaginal fornix to rule out any DIE nodules in the posterior compartment, and I could see a large bowel nodule along the anterior rectal wall in the upper rectum because it was behind the torus. This nodule was continuous with a smaller nodule in the torus over here, and also extending along the uterosacral ligament, along the right uterosacral ligament over here. The lesion, as you can see, is also causing quite significant narrowing of the bowel lumen, which is reduced to this much over here, whereas the normal bowel lumen is quite large, as we can see inferiorly. So the message for this case is never forget your protocol. Even if you find a big finding earlier on in the scan, continue with your protocol so that you don't miss out any other subtle findings or more important findings in a case. Thank you so much.